Why are my acne scars not improving? Hi, I'm Dr. Luther and I'm here to share some insights about acne scars. Acne scars are generally permanent once they are formed. They are the result of inflammatory changes that occur during our less than perfect healing following acne. Put simply, there is destruction of normal collagen and the skin does not heal to the state it was in before. Acne scarring occurs in a few different patterns, broadly based on the shape, depth and size of the scars. Fortunately, these days, we have many effective treatments that can help to improve the appearance of such scarring permanently. It is crucial to accurately identify different types of scarring because the best treatment option can vary. In our clinic, we prefer to use a combination of targeted chemical peels such as TCA Cross, which is best for narrow ice pick scarring, fractional ablative lasers such as CO2 that create microscopic channels of injury that trigger the skin's natural healing processes, RF microneedling that improves on acne scars by promoting healthy collagen production in the affected areas. These are often done in conjunction with lifting procedures such as injecting skin boosters or fillers to volumize areas of collagen loss, and subcision to divide fibrous bands that tether the skin down. The ideal acne scar treatment program should involve your doctor first making an accurate assessment and implementing an appropriate treatment plan for your pattern of scarring.